Sotak. I'm the Public Engagement Director with NC Child, and I want to thank everyone for joining us for our weekly COVID-19 update and legislative update for child advocates across the state of North Carolina. I hope that you're all doing well and safe, given the weight of the moment and the times. It's certainly hard, I feel like, to press on, and that's speaking as a privileged white male in our country. You know, I really want to just take a moment to just maybe let us sit here silently for a few minutes and just think about the weight of oppression that our Black and brown brothers and sisters are under in this country right now and in this moment. And let us just, however you'd like, maybe sit with those thoughts for a few moments before we get started with today's call. All right, thanks everyone. You know, that's really nothing but a small platitude. You know, it's really all about action, folks. And you know, we as white people taking action to try to make some of this change. So let's keep pressing forward here. I know that I'll be bolstered by hearing about the great work that many of you all are doing here in North Carolina to try to make things better for our communities in the midst of everything that's going on. So I'm really excited for us to have on the video chat today two very special guests. We will not have Matt Gross from NCDHHS today. I don't think he's off watching a car race. I do think he's working and doing other things. But we will be first hearing, after a couple updates, from Yazmin Garcia Rico, who is the Health Communities Program Manager at Alamance Regional Medical Center, and also Suzy Khatchaturyan, who's a policy analyst from the North Carolina Budget and Tax Center. And they're going to be talking about COVID-19 impacts on immigrant health and immigrant communities here in North Carolina. And I believe it's my understanding that both Yazmin and Suzy are also UNC-MSW graduates like myself, you know, so there we go. No, we really appreciate them being on. And then we're also going to be hearing a state legislative update from our lobbyist, Ashley Perkinson, as well as Whitney Tucker, our policy director. And then we want to have some time for some open Q&A and discussion time towards the end of this call to talk through some different things. Before we get started in hearing Yazmin and Suzy, I just wanted to make a couple quick announcements. And I'll kind of revisit these towards the end of the call, but I wanted to say first and foremost, thanks to all the organizations who signed on to the early childhood advocacy letter that was sent up to Senator Tillis and Senator Burr, urging them to take further action to support our child care system here in North Carolina. Thanks to all the partners that chipped in and helped with that. I believe we ended up with over 170 organizations signed on, maybe that's right, Fawn, which is really great. And it really was almost Maniota Murphy, like all over the state of North Carolina. And so we will be following up on that, and hopefully that sends another strong message. The other thing, you know, kudos to everyone on our team that pulled together the 2020 county data cards. Those data cards were just released on Wednesday, I believe, and this provides a snapshot for all 100 counties on some statistics around child well-being. And you can find those data cards on our brand new spanking website. And you can go to ncchild.org/data cards and pull those down for your county, and also see some statewide numbers there. Thanks to all the CAN organizations that help distribute that information. I also just really quickly before we get going want to mention that next week we will also have some special guests, and we'll be talking about issues related to K through 12 education. You know, what's going on with K through 12, what's going to be going on as we continue through this pandemic, as well as school mental health and mental health issues for school-age children as well. So next week, we'll look forward to hearing from our guests speaking on that. However, without further ado, I would like to now move us forward and have Yazmin, if she would, to kick us off and talk some about her work and her perspective with immigrant communities here in North Carolina.
Thank you so much, Adam, and thank you so much to everyone for joining today and for having me talk about Alamance County. Which many times we're kind of left out because we're in between the triangle and the triad, but lately we have been in the news a lot. So it's great that we're able to talk about this community. I'm gonna share my screen. With all of you, give me just 1 second. Okay. Let me know if you can see it. Give me it.
Yeah, we see it coming through, Yazmin. Looks great.
Okay. Presentation. Okay, perfect. Thank you so much. So my name is Yazmin. I am an immigrant myself from Mexico. I have been living in Alamance County since 2002. Have been in and out of the county for college and grad school. And every time I keep coming back to Alamance, this is home, this is where I grew up, and this is a community that I really care about a lot. I wanted to start off by giving you an idea of what Alamance County looks like right now. We have 325 confirmed cases. 22 are receiving care at a hospital, and 24 have died from COVID-related circumstances. To bring that back to how this is affecting the immigrant and Latino community in the county, we can see in this chart that the Latino community is about 13% of the county, but they are 34% of the confirmed cases. This is very concerning, and this also reflects the state of things across the state. As we can see in the state of North Carolina is 34% of the confirmed cases. This has been, you know, for many of us concerning, and there's many reasons why this is happening. I'm gonna talk specifically about Alamance County, and I know that this is just a small example of what we're seeing across the state. So Alamance County has different municipalities. One of them is Burlington, which is the city of Burlington. We also have Mebane, Graham, Howe River, and other areas. On this pie chart, you can see 27217 is where most of the confirmed cases have been found. This is an area known as East Burlington, where a lot of the African-American and Latino families live in this county. The 27215 is East Burlington. The yellow one is Graham, and then Mebane. So over the last few weeks, we have seen that more and more cases are being found on the 27217 zip code. And this is an area where I spend a lot of my time working. Before COVID-19, I was putting a lot of time into serving this community, African American and Latino community, in terms of health promotion, access to different activities to promote physical activity and nutrition. And over the last couple months, we have shifted our work to make sure that we continue to support this community that is being affected the most. I also wanted to share with everyone this finding from the 2018 Community Health Assessment that talks about life expectancy. In this map, you can see East and West Burlington, and there's an 11-year gap of life expectancy. And this is a finding before COVID-19. We just wrapped up this community health assessment last year. And it's very concerning to, even more now with the pandemic, to realize that this is gonna change even more, and that these communities in East Burlington were already being affected in so many ways. East Burlington is an area it's a food desert area. Many efforts by different agencies have been taking place around access to food, but there is a lot of work that still needs to be done. So we will see after this pandemic is under control how families are going to be impacted even more in terms of health. So that is kind of a picture, and I was given 5 minutes, and it's really hard to talk about everything that the community is facing in 5 minutes. But I wanted to share kind of, where things are in Burlington, in Alamance County area. We also know that there have been different outbreaks of COVID-19 around surrounding counties, like Lee County, Salar City area, where poultry plant workers have been found positive. We know that some community members from Alamance County also drive to those areas to work. Many of the workers in East Burlington are essential workers. Many of them lost their jobs or were still showing up to work under conditions that are not very safe for them, where there is not an ability to keep a 6 feet distance, where many of them were not given masks and the proper PPE. So early on, when we saw that things were shutting down, people were losing their jobs, I met with Pastor Lisa, who is the director of the City Gate Dream Center, and with whom I have done a lot of work over the last 2 years in this community center. We decided to do a drive-through hot meal program once a week. At first, we thought we could do it multiple times a week, but we didn't realize how much time and really how much work it took to put it together. The first week, it was basically her family and my family. So 10 volunteers, and we gave out 500 meals in one day. Over the last few weeks, it has gone up to 1,830 meals. That's what we gave out last night. There is a lot of need in the community. This community center is located in East Burlington, and that's the importance of this place as a hub it's a place where people feel safe, that is trusted by community members, which is really important. And it's also a central location. People can get there from Half River, from Graham, from West Burlington if they need it. So it's not necessarily just to serve East Burlington, but it is specifically a place that is of access for this community. Like I mentioned, over the last few months, we have been providing these hot meals on Thursdays. It's from 5 to 7. It's open to everyone. And it's we get about over 300 cars with multiple families, sometimes in a car, that are carpooling. To me, this place has been more than just providing a hot meal. It has been a place to provide hope and to provide resources to the community. It has come together by contributions of private donors, small donations, and foundations that are providing this financial support. We are buying food from local restaurants, many times immigrant or Latinx owned, and we're giving back this food to the community. We have provided census information, masks, Strong Minds, which is a coping mental health program out of UNCG. And it's really many agencies coming together to give back and serve this community. I totally understand that this is just a hot meal, you know, it's once a week and it does serve families, but it's on a very, very limited basis. This is just an example of the work that my department is working on. We're also supporting the food pantry at Catholic Charities that provides food for 5 days, twice a month. We have been serving about over 300 families. 700 families, and it's about 3,200 individuals. Every month it continues to grow. And SAFE, which is in Southern Alamance, another food pantry that is providing support. I haven't been as present at SAFE, but I've been helping to translate their post on Facebook into Spanish and share with other community leaders. Over the last few months, their numbers have increased in terms of serving the Latino community. I was recently on a call with the ED, and she mentioned that right now their serving to the Latino community has increased by 70%, and they are now 90% of the families they serve. So they have really increased their serving. I'm really appreciative of all the agencies that are trying to support the Latino community. They understand that they are being left out of many benefits and many, just supports that are coming from the federal government, such as the stimulus checks and the unemployment. And that's kind of what I wanted to touch on. We don't ask when families come, you know, if they're undocumented or not. We are serving everybody. Most of them are Latinos. But we know that they are going through a lot. We know that they're facing a financial burden, that they are really stressed, that family members might be sick. And over the last few months, this has been a chance for us to hear from them and really understand what they're going through. With a lot of information coming from the state in terms of the stay-at-home order, what that really meant, children having to take classes online and them adjusting to those processes with the new EBT cards and the benefits that some of the families will be able to access throughout the summer. So it has been a way to kind of continue providing that support and making sure that they feel that, they're not alone in this process, that we are there for them and we're walking with them alongside to make sure that we try to support them as much as possible. Another effort that has come over the last couple months, early on we heard that many families were asking about diapers. They needed diapers. We know that it's not an item that can be bought through WIC and SNAP benefits, and they're pretty expensive. I've learned over the last few weeks. We are part of the Healthy Mothers, Healthy Babies coalition out of the health department. And initially we came together, I believe it was like the second week after things started escalating. And we were trying to do a focus group with Latino women to hear about their health and their baby's health and try to come up with the strategies to support them. But quickly that turned into rapid response to making sure that their basic needs were met. We coordinated a virtual baby shower that went around Facebook and different listservs. People bought diapers online and sent them directly to the Dream Center, where we distributed them along with the meals and in different hours as well. Quickly, the word got out and we were thankful to be connected with the Durham Diaper Bank. And now we are an official site of that diaper bank, which has been great because we don't have to continue asking for donations of diapers. We can shift our focus to the next thing. Over the last few weeks, every Thursday, we have served an average of 160 families. Most of them are Latinx and African American, again, because of where we are placed, but we're open to everyone. We have gotten the word out through social media, through DSS, different nonprofit organizations and community organizations that are supporting these communities. And really, there is a lot that we could talk about in terms of Alamance County. We have been in the news over the last couple of weeks now for great reasons. We know already that this is a hard place for Latinos and for immigrant families to live. And we could go on and talk about the reasons why. But this crisis, this pandemic is really hitting hard these communities, the Black and Brown communities. They were already, being affected by structural racism, by many systems that were already leaving them out. But this is just, making everything bigger and really making them suffer even more. A lot of them unemployed, facing the financial barriers and challenges of not being able to pay bills and utilities. That's what we have heard the most. At the beginning, it was the need for food because people needed to, feed their families. And now it's growing into the concern of how to make sure that they keep the lights on. They're aware that their electricity is not gonna get cut off right now. Or utilities, but they're definitely concerned about the bill that continues to increase month after month, and evictions that could be possible when courts start working in that way. So right now at the Dream Center, we're working on applying for grants that would help with that financial assistance. We hope that we can support the community in that way. Again, we are aware that many of these immigrant and Latino families were excluded of many benefits. And an important number to keep in mind, there's about 350,000 undocumented people living in North Carolina. Again, this is the undocumented people. We have a lot of mixed status families. So the number of families affected is larger than this, because if one family has one member that is undocumented, automatically that family would not get a stimulus check if they filed their taxes together. So this is some of the work that we've been doing. Something else worth mentioning that is working for us in the county, I facilitate the Latinx Health Network, which is a group that comes together once a week right now, and we share resources, we talk about challenges, and we try to support each other. This is agencies from family abuse services to clinics to different agencies around the county that have a Latino advocate or a Latino staff that works with the Latino community. Because many times we know that the needs and the access is different for our community. So that has definitely worked for us in terms of better supporting the Latino community. And I think that's most of what I have. I wanted to leave some time for questions. We are working on community testing right now. I hope to have 2 sites in June. One will be in East Burlington and the other one will be in Southern Alamance. So testing continues to be a big need. And as we open up more places, we'll get a better picture of where the county is and where more resources need to be, directed. And thank you so much. And I want to leave some time for questions.
Thank you, Yazmin. And thank you for the work you're doing. It's amazing, and it's great to hear about it and get an update and allow others to learn from it. So thanks for sharing. Let's see, Fawn, do we have a couple questions in the chat?
We do. There's a question from Mebin Boyd about the community health assessment, Yazmin, and just where did that come from and how could she replicate that in her community?
So the community health assessment in Alamance County is done every 3 years. It is a collaboration between Impact Alamance, which is a foundation, the health department, Alamance Regional, Healthy Alamance. So many organizations come together and we do a whole community assessment. We did different focus groups with the Latino community, with the LGBTQ community, with single family households, all throughout with Native Americans. And then we brought this together. I think it has changed throughout the last few years. The state does provide some directive of what they're expecting. It is different than the the assessment for the hospital. So it is more county-wide, and I can share the link to that document. I know that every county should have it because it's mandated by the state. And this past year, well, it feels like this past year, but the most recent one, we included an equity lens in the community health assessment, which was really important to make sure that we're bringing up the needs from everyone in the county and really trying to make sure that we keep that in mind as we are coming with strategies to work on those issues.
Great, and there's a question from Dr. Clark-Pearson about vaccinations for the 0 to 2-year-old population. Is that something that you all are working on?
So we have heard from the health department that is something that is coming down the pipe. Every week we give out different information and resources. Right now, that's something that we definitely want to share with the community to make sure that the wellness checks are something that families continue to do, and vaccination. We're also trying to do enrollment for kindergarten, any information that that agencies need to be shared with the community. We've become a popular place and one of the only ones where people are coming in a safe way with PPE, with, all the protocols that need to be in place. So we'll definitely be encouraging that.
Great, that's it for our questions in the chat box. Thanks so much.
Yeah, thank you so much. And now we're going to hear from Suzy. So Suzy, if you would mind going ahead and chatting with us. And again, Suzy works with the North Carolina Budget and Tax Center out of the North Carolina Justice Center in Raleigh.
Yeah, thanks, Adam. And thanks for having me. I'm excited to be part of this call this week. And thank you, Yazmin, for providing all of that really important information about what's happening in Alamance, both in terms of COVID-19 and also what the local response is looking like. As Adam mentioned, I'm a policy analyst at the North Carolina Budget and Tax Center, which is a project of the North Carolina Justice Center. So we do a wide variety of policy work as it relates to immigrants. So this presentation is just going to be like the tip of the iceberg. But I'm happy to, answer questions after my presentation and also on an ongoing basis and connect you to my colleagues that are doing a lot of other great work. So I think Fawn is helping me advance the slides, so thank you, Fawn. Just to give a brief overview, I'll talk first about the state response, and then I'll jump into the federal response. Just jumping right in on the state response, it really began with the first 2 bills that were enacted by the state legislature earlier this month. This was a $1.6 billion package, and it allocated about 44% of the state's largest pot of federal dollars that were dedicated to COVID-19 relief. And that came through the CARES Act. So these 2 bills allocated dollars to public health, to community health centers, free and charitable clinics through their association, pharmacy assistance through NC Medicist, and food banks, just to name a few. And the areas that I've mentioned are all components of the safety net, albeit they're outside of the programs that we typically think about when we talk about the safety net. But given that the safety net programs do largely exclude many types of immigrants, I think it's important that these safety net programs are funded in the ways that they have been thus far. So we see that those first 2 bills as an important first step in the state response. But as we'll, I'm sure, hear more from Whitney later on, there's lots of other legislation being considered in the legislature currently. So in the bills that were passed, the state also authorized the agency to provide coverage for COVID-19 testing to certain uninsured people. And that was an option that was given to states through the Families First Coronavirus Relief Act. So states are not required to provide this unless they plan to take advantage of the additional federal match dollars for Medicaid. So this provision provides uninsured individuals with access to COVID-19 testing and the vaccine once it's available through the end of the National Public Health Emergency Declaration. Unfortunately, it only applies to people who meet Medicaid immigration eligibility requirements. If you're not sure what those are, we have lots of resources on our website there that you can see the link to. For people who are eligible, this use of Medicaid in this very particular way will not be considered in a public charge determination, and I'll touch more on that later. I'll also mention that that some states are pursuing statewide cash assistance to immigrant families. Unfortunately, North Carolina is not yet one of them. But like Yazmin mentioned, lots of immigrant families who don't file taxes with a social security number, but who use an ITIN or an individual taxpayer identification number, were ineligible for the economic impact payments, which is the same as the stimulus payments. There are, however, some local efforts being, I'd say they're all at their very early stage. Some of my colleagues are leading those conversations with local leaders about how to create local funds for those immigrants who were ineligible for those stimulus payments. If you'd like to talk more about that, I'm happy to do that, and I can connect you to my colleagues who are doing that work. On the next slide, I'm going to talk briefly about the Pandemic Electronic Benefit Transfer, or PEBT program. This is another program that was enacted as part of the Families First Act. You might be wondering why I included it as a state response, and that's because states still need to apply with the state plan to the federal government and receive authorization from USDA in order to implement the program. North Carolina was actually one of the first few states to be approved and roll out the program, which we're sort of in the middle of. And this was actually highlighted this week in a piece by the New York Times. It's a pretty good article, so I'm happy to share the link to that if folks are interested. So this program is meant to compensate for the fact that schools are closed and students who would otherwise be eligible to receive a free or reduced lunch or breakfast can't do that while schools are closed. And it's especially important right now as many families have lost incomes. They're now becoming newly eligible for the program. So the program provides $5.70 approximately per student per day, and it's backdated to the time that schools were closed. So there's several ways that it's being rolled out depending on a few things. So families receiving FNS benefits will receive the additional benefit on their existing EBT card. Families that are not receiving FNS benefits but we're receiving free and reduced price lunch will be mailed cards and information about how to activate and use them. They don't actually need to do anything. And then families who are eligible for free and reduced price lunch, but were not receiving it, and are also not receiving FNS benefits, they should contact their school to get enrolled in the program to find out the latest information on that. I know the department is asking folks to reach out to their schools to determine the best way to enroll in that program at this point. And so we think that this is one of the most important benefits as it relates to immigrant families, given the broad eligibility requirements for the program and the substantial amount of the benefit. So it's going out in 2 payments. And we're hoping, I'll touch on this a little bit later, we're hoping that the federal government will extend these benefits through the summer, given that summer is typically a time of high of high food insecurity while students are out of school. And then I'll also mention that this benefit is also not considered in a public charge determination. Even though it's a new benefit, it's very similar to the way that public charge is handled as it relates to free and reduced price lunch. So it's important to let families know that shouldn't be a concern, although you know, it's reasonable that they would be concerned. And then on the next slide,
Suzy, just a quick time check. If you could maybe push through in about 4 more minutes.
Okay, I will try to do that. Sorry.
Sorry.
Very ambitious in my slides. So I won't talk too much about this, but there were many changes to existing programs. This just highlights a few. You know, a lot of these are in response to the need for remote measures, and they're sort of pulling down what the federal government allowed, but this is just a high level of what was, of what the state has been changing. The 4 pieces of federal response, 4 pieces of federal legislation that have been enacted thus far are listed here. I've already mentioned a couple of them. The first bill was largely just funding for state and federal public health agencies. The Families First Coronavirus Relief Act included a lot of really great Medicaid provisions that I've already mentioned, although they don't go far enough. But the CARES Act predominantly included funding for state and local governments. This is something that we've been working on a lot at BTC. And then the 4th package included funding for health systems, clinics, COVID-19 research, and small businesses. So the pace has sort of slowed down, as you can see. And then I just wanted to mention briefly federal agency notices. So I've mentioned that some of these programs are not subject to public charge determination. USCIS has also updated their website to specifically point out that you know, benefits used as they relate to COVID-19 will not be held against someone in a public charge determination. The next step is to actually get that into statute. And ICE also issued a statement saying that they will basically back off from any immigrant enforcement work at sensitive locations like hospitals and clinics. So along those lines, the HR 6800, which is being referred to as the HEROES Act, you've probably heard about this. It was passed by the House a couple of weeks ago. We're hearing that it's unlikely that, I'm sorry, I'm 2 slides ahead now. That bill includes a lot of really great provisions like clarifying that COVID-19 testing, treatment, and vaccines are available through emergency Medicaid, which is something that currently states are doing on an individual basis, which is leading to this, this patchwork effort. It would include the inclusion of ITIN filers for economic impact payments, and it would extend pandemic EBT until schools reopen. It does not include important things like I just mentioned, which is putting statutory protections around sensitive locations and also suspending the public charge rule altogether, which is a really important thing given that, you know, folks are, you know, nervous about going and getting care that they are otherwise eligible for. So that was a whirlwind, I'm sorry. I hope that will at least, you know, kind of get the wheels turning and get folks, you know, thinking about what has and hasn't been done and what more needs to get done.
Thanks so much, Suzy. No apologies needed. I apologize that we're kind of squeezing a lot in here. And I think what I would like to propose now is to let Ashley and Whitney talk a little bit from the state legislative update angle. And then if we have some more, then we'll have a few minutes at the end and we can do a few more questions. I know I've got a question or two related to the information you all shared as well. So,
hey, Adam, just 1 second. I know Yazmin does have to leave early, so I will ask if anybody has questions for Yazmin. Let's get them in now before she has to jump off. Thanks. And I actually don't.
Thank you for reminding me.
I don't see any popping up in the chat box, but just wanted to make sure. So thank you.
Okay. All right. So let's move forward now to Ashley, I think, first. Ashley Perkinson. Hey.
Hi there, Adam. Thank you so much, and thank you all for joining us again this week. And I'm going to go over kind of a big picture of where we are with the development of the state budget, some of the developments there this week, and then I'll turn it over to Whitney to talk about some of the bills that have been introduced and a success story that we'd like to highlight as well this week. Some good news in the midst of a lot of sad and bad news. But in regard to the budget update, so the week began with the presentation by the General Assembly's economists discussing the budget shortfall and what the legislators will be dealing with this session. And so what we're looking at is around a $4 billion revenue shortfall as they look at developing a state budget, and that is with an addition of $1 billion, around $1 billion shortfall with the Department of Transportation. And so Barry Boardman, the economist, spelled out this landscape. He also said they would do an updated forecast, updated assessment in mid-August once we get a better revenue picture in mid-July. As you remember, the tax filing deadlines have been pushed back to mid-July, so we'll get an even better picture in August. So quickly, what that means for the state budget. At this point, we don't know whether the General Assembly will actually develop a full new state budget. What we've seen introduced this week have been a number of mini budgets, both on the Senate side and also on the House side. A lot of these mini budget bills, and that's mini M-I-N-I, mini budget bills have focused on capital projects, and there's one focused on funding for the new School of Science and Math in Morganton, some UNC capital projects, some funding to go to juvenile facilities in conjunction with Raise the Age. So a lot of these mini budget bills have been introduced. Some have passed the chambers that they were introduced in. So there's a lot of action going on, a lot of movement. One big question as to whether there will actually be a new state budget developed is what happens with the remaining around $1.9 billion remaining in the federal CARES dollars that the state can spend. Legislative leadership is hoping for additional guidance from the federal government that allows more flexibility and would allow them to plug those state revenue shortfalls with that pot of money. That directive from the federal government hasn't happened, and so at this point it's not clear whether they will get that directive and what that will say, even if they do. So at this point, the state budget development seems to be somewhat on hold as they develop these mini budget bills. And then the question, of course, looms, what will happen with the remaining $1.9 billion in federal dollars? Will that be primarily used for COVID-19 relief as it was primarily passed? Or will there be additional flexibility so that those funds can be used to plug some of these state revenue budget shortfalls? And a colleague of mine has described this session, and I think this is a great way to put it, as the session of preserving and protecting, because again, the legislature is required to have a balanced budget. and with a shortfall, if there are cuts that will be made for those priorities that we are working on, really focusing on making the case for why funding, especially for health and early childhood priorities, while that needs to stay in place and not be cut, as they will end up very likely looking at where to cut in the budget and the loose change in the cushions of the General Assembly.
Thank you, Ashley, for that overview and for keeping us up to speed on that budgetary angle, because that's going to just be crucial that we as advocates have some kind of understanding of that as it moves forward, because it is going to be a tough budgeting year and conversation. So really appreciate that. Now let's go to Whitney Tucker, our policy director. Hey, Whitney.
Hey. Let's do this. So as Ashley mentioned, the General Assembly has been responding to the really bleak and uncertain revenue forecast by launching all of these mini budget bills to fund top priorities rather than developing a single budget bill for the coming fiscal year. That is a mess. But the House rolled out 3 bills in the Appropriations Committee yesterday and passed them on the floor later in the day. And I wanted to really highlight one of those that we were really glad to see. It's House Bill 1187, which would allocate about $10.4 million for construction of 3 juvenile detention facilities in Rockingham, Granville, and Perquimans counties for moving 16 and 17-year-olds out of adult prison. This is the next phase of Raise the Age implementation, so it is really promising actually to see the General Assembly really affirming that priority and moving this forward even in the midst of all of the other uncertainty. So that's a positive note. Another bill that we are delighted to see moving is Senate Bill 476, which was originally introduced back in April of last year and then sent to conference committee in October. The bill is titled School-Based Mental Health, and among other things, it requires public schools to adopt and implement a suicide risk referral protocol and mental health training program. New conferees were appointed last week, and since then, the conference report on that bill has been adopted in both the House and the Senate, and the ratified bill is now being presented to the governor today for signing. So those of you who have been a part of our Child Advocacy Network for a while know that NC Child has been working to get this suicide prevention bill through for years. So we thank you for your partnership with us in promoting this issue. In 2018, 52 children, 10 to 17, died by suicide in North Carolina. So it is important that we're doing everything we can to have trained adults ready to see the signs of suicidal ideation and get children the help that they need before it's too late. Mental health obviously is more of a concern now than ever with everything that's going on in our country, in the world. And we're glad to see that this piece prioritizing kids in the midst of that has been moving forward really rapidly. And as Ashley alluded to, there have been numerous other bills filed recently. Suzy also mentioned this, but a lot of them really have great provisions that could benefit kids and families if they were to move forward, though we don't expect most of them to. You'll receive an email update with quick summaries of this week's filed bills that most closely align with our policy priorities. But one bill I want to pull out of that stack while we're still on the call today is Senate Bill 808. This bill, Medicaid Transformation Necessities, is really similar to HB 555, which you guys might remember from last year. It was a transformation funding bill that passed the House and the Senate in August and was subsequently vetoed by the governor. That bill was one of several mini budget bills that Governor Cooper vetoed last year after the General Assembly failed to include Medicaid expansion and other administrative priorities in its Appropriations Act, which was also vetoed. The bill would require Medicaid managed care capitated contracts with prepaid health plans to start January 1st, 2021, with the option to phase in enrollment regionally. Initial recipient enrollment would need to be complete by the end of May 2021. Funds for rebates and transition costs and non-recurring needs are mostly unspecified in the bill as a sufficient sum. Although fiscal year 2021 non-recurring qualifying transformation needs are specified to not exceed $140 million. A Medicaid transformation hotline is included in the bill, but neither the enrollment broker nor the ombudsman are referenced in it. So not sure exactly how it would logistically work. The bill also requires hospital assessments and establishes both a Medicaid contingency fund and a hospital uncompensated care fund. Right now, SB 808 is sitting in the Senate Appropriations Committee, where it is likely to stay this session, but I wanted to be sure that it's on your radars just in case. And as a reminder, NC Child is just tracking the bill right now, and at this point, we're not in support of any form of transformation without Medicaid expansion, which you all know is our top line advocacy priority. So since we're tight on time, I can leave it there for now and answer questions in the chat if folks want to talk about other specific bills that have been filed recently.
Thank you, Whitney and Ashley. Really appreciate the updates. And I'm glad you mentioned the Medicaid transformation issue, because that is going to be fascinating to see how that plays out in the midst of this pandemic. And I know that there's a coalition that's been formed by the health plans, the North Carolina Medicaid Choice Coalition, and they're going to be advocating very strongly for that to happen. As you said, NC Child has said all along, well, we need to also be expanding coverage and protecting coverage and doing that. And how all of that also rolls into federal issues will also be interesting. And when I say that, I mean specifically, will Congress approve in a stimulus package an increased percentage of federal money coming to the state for Medicaid, or FMAP increase? They increased that 6.2% in one of the previous stimulus bills, which I don't have the number off the top of my head, will bring in about $1 billion more per year into North Carolina for Medicaid. But they could, and we are advocating that they even double that amount of the FMAP bump and take the bump up to 14% or something. And so that will play into this as well. Do we have any other questions or issues that have popped up, Fawn?
I am not seeing any additional questions in the chat box, but folks, if you have a question you want to ask to Whitney or Ashley or any of our other speakers today, you are welcome to enter those into the chat box. We're actually in a meeting format now, so if people want to unmute themselves and ask a question, or even turn on your camera and wave at everybody, you can do that. So it's not a webinar anymore. We're actually in a format where you can participate that way. Right now, I do not see any questions in the chat box, but I do want to remind everybody that we're recording the call and we'll be sending you the video afterwards. And we'll also be posting the Spanish language video to our website later this afternoon. Thanks to Vicki Krause for making that happen.
Wonderful. Well, thanks again, everyone. As another reminder, again, next week we will be talking K through 12 education and school mental health. Thanks again for signing on to the early childhood letter that we have sent up to DC, and we'll keep everybody posted on that. And be sure to check out and share those county data cards. Go check out our new website, and then you can link to the data cards there. Thanks, everyone. Have a wonderful day. Take care.